Hello, my name is Roger Wickenden. I'm a director here at Barton Lodge Veterinary Centre in Hemel Hempstead. I've been a veterinary surgeon over 30 years now, so today what I'm going to try and do is to answer some of the questions you've been asking about your dog's health problems. How to treat mange. Before you can treat your dog for mange, an exact diagnosis has to be made by your vet. Your vet will need to confirm your dog has mange and, more importantly, what type of mange your dog has by skin tests called skin scrapes. And sometimes you might need blood tests, especially when you're trying to diagnose sarcoptic mange, where it can be very difficult to find the mites. Demodectic mange is caused by a cigar-shaped mite that lives in your dog's hair follicles. In fact, it lives in to a small number, it lives in all dogs, but Demodectic mange is in fact primarily a manifestation of a specific hereditary immune deficit, which allows the Demodex mite, a normal inhabitant of the skin, to multiply in abnormally large numbers in their hair follicles. And it's usually in young dogs, primarily 3 to 6 months old. Classically, it's in short-coated breeds like bulldogs, boxers, Great Danes, Dobermans, Rottweilers, and at the moment, unfortunately, another problem for poor old Staffies, we see it in a lot of Staffordshire Bull Terriers. Demodex occurs primarily in two forms. You've got localized Demodectic mange, which just affects the face and the legs, and it only requires treatment with a benzyl peroxide or chlorhexidine shampoo to clean out the hair follicles. And also, something that might help, in the UK there is a flea treatment which contains a moxidectin imidaclopramide combination, which has a license to treat Demodex as well. Now, cases of generalised demodicosis, however, are a whole different ballgame. These will require whole body washes with a product containing amitraz, which is a really nasty smelling stuff. And you'll have to do that every week, whole body immersion, until you have had 2 successive skin scrapes where your vet has found no mites. So you're in for the long haul. Sarcops mite prefer the skin with little hair. So it tends to start on the ears, the elbows, the abdomen and the ankles. And sometimes if you just rub your dog's ears, the flap of your dog's ears together, it will stimulate them to scratch with their back leg, and they are exquisitely itchy, and you don't have to do that very much, and that can be suggestive of sarcops. Now, for your vet to diagnose sarcops, it will either be looking for the little mites on a skin scrape, but sometimes there aren't many to find, and there is now a blood test that's available so that you can detect sarcops even when they're hard to find. Successful treatment for mange will require an accurate diagnosis by your vet and the use of the correct veterinary licensed drugs. And as importantly, you need to continue treatment for a long time to make sure that you have completely eliminated either the Demodex or the sarcops infection. So that's how to diagnose and to treat mange in dogs.